I totally foresee a time where basically 100% of patients with this disease, ECD, will have a specific genetic cause identified for their disease with a drug available for that genetic alteration. I think that that time is coming very soon.
I have patients now that I've seen every month for going on now several years, and I've watched them transform from patients who couldn't stand up or articulate themselves to people who are living pretty normal lives.
It is so unbelievable that we're now at the stage that they're actually talking about treating the disease rather than just treating the symptoms of the disease.
My name is John DeWitt, and I was diagnosed with Erdheim-Chester disease recently, and my adventure started with a heart attack, which I had in 2007.
John's journey with Erdheim-Chester disease was in many ways typical for Erdheim-Chester, and it started also with cardiac symptoms. Erdheim-Chester disease is a disorder which leads to accumulation to certain cells which we call histiocytes, which can essentially very much accumulate anywhere, but there are some areas of the human body in which they are more likely to accumulate, such as heart, such as bones, brain, around kidneys, and which ultimately can interfere with the function depending on what organ is involved.
A member of the trumpet section of the Houston Symphony, have been for 32 years. This health issue does take away from my ability to play the instrument quite exactly like I used to when I was younger.
There have been some very hard times, to tell you the truth. It's a new way of being, and we had to find our way to what works in this new reality.
It's a group effort between the patient and the family. It's not just a disease of the patient. It impacts everyone. One thing I have found that's been pretty consistent has been recommending physical therapy. And the patients that we've done that with have said it's been extremely helpful in their quality of life.
Dr. Janku was very positive about this medication. He'd just come back from the first symposium, ECD, Global Alliance. They had just identified this genetic mutation that's related to at least some of us who have this disease. And I tested positive for that genetic mutation, and so he started me on the clinical trial. And I'm now in wonderful care of some wonderful doctors, and the future looks very bright for me.
There's been some long-standing questions about whether Erdheim-Chester disease qualifies as a cancer or not. One of the discoveries that, in my mind, added a lot of clarity to that question was the discovery of the B-RAF mutation in about 50 to 60% of patients with Erdheim-Chester disease. The B-RAF mutation is a mutation that we see in a number of different cancers. In the mind of myself and a lot of other physicians in the area, that really helped reclassify this as a cancer over autoimmune disease.
The clinical trial that we have here is for patients with Erdheim-Chester disease whose tumor has the B-RAF mutation. The goal of the trial is not only to establish the fact that the drug works, but also, I would think, to ultimately get approval for a drug to be prescribed for Erdheim-Chester, and this is unprecedented.
And so far, it's very clear that the drug really has true efficacy in this disease. And the patients that have been treated on this will tell you that firsthand.
The results that we've seen by targeting the B-RAF mutation in the approximately 50% of patients that have it have been dramatic. And we have very, very active research efforts to understand what mutations or alterations are present in the 50% that don't have that mutation. and to develop therapies based on our understanding of how those other mutations function. In the study that we did in collaboration with MD Anderson, we showed that the amount of the B-RAF mutation in the urine changes in reflection with how effectively you're treating this disease. The advantage of the urine testing is that it's a non-invasive test, and it seems to have excellent ability to detect the B-RAF mutation. So I think it's a technology that's particularly valuable to this patient population.
When you get a tissue biopsy, which often is obtained from the bone, the quality of the material is not good enough to do all these important studies to find out what is the molecular makeup of the Earham-Chester disease in that specific patient. And we have actually invested quite a lot into development of tests which can test for molecular profile of Earham-Chester disease from materials other than tissue biopsy. There is even now available a clinical test which can actually detect B-RAF mutation in urine.
Erdheim-Chester patients need to be followed very closely because there can be symptoms, problems that come up frequently and come up over time, and someone has to be able to recognize whether they are the result of the disease, the result of treatment, the result of other medical problems.
If we share information, I think we can actually make a substantial progress in diagnosis and treatment of diseases such as Earham-Chester. We do collaborate with other centers. There is also collaboration which is happening worldwide.
Not very many people know about Erdheim-Chester disease, and so it's critically important to have a natural history study to bring in a large number of individuals who have this disorder and seeing them repeatedly.
I was the first ever case of the disease in the country of 5 million people, which was very difficult in itself because nobody, including the physicians, had any idea what they were dealing with.
Mr. Dooley, he was first diagnosed with diabetes insipidus in the year 2007. And in 2012, his diagnosis of Earham-Chester disease was confirmed. And this was a lack of diagnosis of approximately 5 years.
It's just basically different levels of pain that you have throughout the day. So control of pain is a big part of my life, and it's been the hardest part of Erdheim-Chester.
One patient can have just bone disease, other patients can have just isolated disease in the brain or anything in between. Some of these patients don't have good pain management because the disease doesn't respond to certain pain medications like other types of pain will respond.
I'm one of the first 3 patients to undergo this new treatment, a new set of drugs, with a view to basically making real progress on the disease.
And learning more about the disease, we were able to do a partnership with the National Cancer Institute, and we were able to move from the natural history protocol phase to a treatment phase. And now we have a phase 2 trial where we're testing this safety and efficacy of 2 drugs that are inhibiting the pathway that is affected in this condition.
I'm actually more optimistic about this clinical trial than I've been about any clinical trial. For one thing, it's run in an incredibly rigorous fashion. It really has 2 drugs involved, one that addresses the BRAF itself and the other that addresses a problem downstream. And when you have combination therapy like that, it's often incredibly successful.
Mr. Dooley, he's a really positive person. He's looking for a cure, and he's looking to improve his healthcare as well as help other people that are diagnosed with this disorder.
Obviously, I'd like to live a few more years to see my family. I have young children. It's difficult for me to talk about that because it's very close to my heart, but it keeps me going.
I don't think it's coincidence that a lot of advances in Earham-Chester disease happened after establishment of ECD Global Alliance. That actually provided a platform for us as medical professionals, patient advocates, patients and their families to communicate, to share our experiences, to share ideas and plan how to move forward.
I would say that the ECD Global Alliance is essentially the only reason why we have a protocol here. In other words, we need recruitment of individuals, and we need a leader who can essentially convey to the patients who have this disorder how important it is to do clinical research and how this is really for their benefit.
Patients and families should register with the ECD Global Alliance so that they can know that they're not alone and so that they can be directed to the best treating physician that may be close to them, and also so that they are counted and so that we know that they're out there.
If you're newly diagnosed with Earham-Chester disease, there is a lot that has changed. Don't be afraid to ask questions. Don't be afraid to ask for a second opinion. If they get diagnosed in a state that doesn't have a referral center, reach out to those centers that are registered with a Global Alliance.
Just have your doctor contact us and we can give them information and learn about your case and provide some recommendations.
The smart minds in the world are working on this thing, and they're looking for answers to the questions that we all have. And it's going to happen. It's going to happen.
Join the Global Alliance. It has changed my outlook on the disease. It has led me to a lot of friends, a lot of people that I'm in touch with on a weekly basis. It has given me support in days that are bad, and it has also led me to believe that there is hope out there.